So I lost 51 pounds on compounded tirzepatide. It took me about 9 months, and I am no longer actively injecting every single week, but I do for a maintenance. So come with me. I'm going to take you inside my practice so you can see what I do, what other vitamins do I get, and how do I make sure that I keep the weight off, and also for all the other benefits that happen to your body when you are on GLP-1. I'm here. I usually don't use the front door, but here we go. Okay, so this is compounded tirzepatide, and this specific concentration is 20 milligrams per milliliter, meaning in 100 units, there are 12.5 milligrams of tirzepatide. Obviously, I am not at that high of a dose. I'm just on maintenance, and for maintenance, I only inject 2.5 milligrams of the medication. Of course, your provider will be the one to let you know what type of maintenance dose will be ideal for you. So if you're on compounded tirzepatide and you actually get the vial from the pharmacy, I always recommend to get the vial opener, because there's always a little bit of medication that is left at the bottom of the vial that you can get with the needle. So let me show you that. You can get this out of Amazon and then just hold on top and just open it up. That way you can actually get to the little bit that is at the end of the bottle or vial. Open up your alcohol pads, and then you can get anywhere in the belly where you have fat to inject. And again, I'm on a maintenance dose, so I'm not on a higher dose, and I always like to alternate where I inject. That's it. And I also like to inject L-carnitine as well, because this just helps my body, it helps my metabolism, and this is a must, in my opinion, if you're on active weight loss journey, or if you're just on maintenance. Also, if you exercise, I honestly think everybody can benefit from L-carnitine. So L-carnitine is intramuscular, which means that it needs to go into the muscle. And just to show you, I'm just going to inject on my tricep. Usually I will inject my booty, but I am not going to show you my booty, sorry. So let's inject my tricep. And yes, this burn, so I always tell my patients, it's gonna burn a little bit. That's it. Another one that I like to do is Lipo Plus. However, this medication or this supplement has vitamin B12, and unfortunately I can't do B12 when I'm having active acne. So since I'm having a few active breakouts, I'm gonna skip the vitamin B12, which means I'm gonna have to skip the Lipo Plus. Okay, so I hope you enjoy this do it with me type of maintenance injections, and I'll see you next time.